Well, how many years can you really shave off of your appearance by going under the knife? Here to talk about facial plastic surgery is Dr. Dean Sutherland. Of course, specializes in neurology, but hey, we'll talk about plastic surgery today because it's something that a lot more people are becoming interested in.
It's true, there's a lot of it that goes on, in Sarasota especially. Did you ever wonder how much it actually makes a difference?
Yeah.
You know, there was a nice study that was done in Toronto by this Dr. Chi Wan. He had first-year medical students look at people before and after plastic surgery. So the first procedure they did was just, the turkey waddle neck here and pulling the face back. It's called a facelift. The second procedure was they would do the eyes, above or below, and the third one was a brow lift. And so they looked at the different things that were associated with looking years younger. So if you just do this and this, it's 5.4 years or so. If you do the whole thing, it comes out 8.9 years.
Okay, so we have to debate, is it worth 8 years? Is going under the knife worth it? Now, this is a major surgery. Talk about some of the risks involved with plastic surgery.
Well, in my practice, I know that I've seen nerve injuries. I've seen people with muscle injuries. So there's facial pain syndromes that go along with it. Of course, if you don't find the right person who's really qualified and has been real well trained at what they do, then there's a lot of complications that happen. Even people can go in the hospital as a result. So you do have to look for somebody that is board certified. There is a fellowship program that people do beyond their general surgery. It's very extended. We have a lot of really good plastic surgeons here in Sarasota and Manatee area. So it's important to find one of those. Anybody can call themselves a facial plastic surgeon if you have an MD behind your name. But that's not really the case.
But you really need to look for a specialist. You need to talk to people. You need to ask for referrals, look at their credentials, all those things.
Right. We all want to look 10 years younger.
Of course we do. Why not? But there's not an easy fix necessarily. There's some other things you can do. Smaller procedures. Let's talk about some of those and if those make a difference.
Well, people have injections into their lips. They have Botox, things like that. And actually, if you do a lot of different procedures, a lot of smaller ones, make people look younger than if you have just one large procedure done.
That's what was found in the study, right? A lot of little things add up. So you don't have to go for the full total facelift. You can do just a lot of small things.
That's right. And actually, they also mentioned that probably your skin tone is also important. So don't smoke.
Don't smoke. That's good advice for all of your health reasons. But okay, and then talking about the actual procedure of the facelift, it's not necessarily an easy thing. Tell us a little bit more about it.
It is very involved. You have to have somebody that really knows where the nerves are, where the muscles and the vessels are, but you have to undergo general anesthesia, and it takes a while to do it. And there's some recovery time. There's 3 to 6 months of recovery time until you really look like there's no puffiness or swelling or scars or things like that.
Okay, so if any of your patients ask you, I've been thinking about having plastic surgery, what's the first thing you tell them?
Well, I do get that question. I say, if you do it for yourself. Don't do it for anybody else or any other reason. And find somebody who really is good. And they will ask me for referrals. And so I do refer them to people who I think are very skilled at it. Okay,
and then just real quick, since we were talking about your specialty in neurology, Botox, which could be used for the wrinkles, can also be used for migraines.
That's right. So there's been good studies that show if you have migraines more than 15 days a month, chronic intractable migraines, that the Botox injections can significantly reduce those to about half of what they were. And we've seen that in my practice. Dr. Haynes and Dr. Nagoski, we all do those for migraines, and it works.
Okay, so it might not be injecting in the same place, but...
Right. Yeah. We don't do it for cosmetic reasons.
That's right. It might not get rid of the wrinkles, but it'll help with the migraines.
People usually want to splash a little bit of extra Botox.
I'm sure. All right. Well, thank you, Dr. Sutherland. Very interesting topic today. And now it's time to check in with Dave Anderson.